Syringe service programs are a huge resource that has a highly positive effect on the communities that they are in. Today, I will be telling you how syringe service programs, or SSPs, reduce infection, help prevent drug use, as well as talk about what cons are typically perceived about SSPs and why they are inaccurate, how cost-effective SSPs are, and why it's important to increase policy and financial support for these services. Before jumping into that, do you know what SSPs are? Do you know what dangers come with IV drug use? Syringe service programs, also known as syringe exchange programs or needle exchange programs, are community-based programs that provide individuals with access to sterile needles and syringes, safe disposal of used syringes, and other important services and programs such as referrals to addiction treatment programs, screening and treatments for hepatitis and HIV, education, vaccinations, screenings for STDs, wound care, access to Narcan and fentanyl test strips, as well as referrals to social and medical services. Syringe service programs tend to be aimed towards providing a safer using situation for injection drug users, but these organizations also work with other drug users, sex workers, homeless populations, and more. Injection is probably the most dangerous method of drug consumption, and its side effects kill thousands of people every year. Some of the most common dangerous side effects include vein damage, infection at injection sites, nerve and tissue damage from incorrect administration, and tetanus and cellulitis. In severe cases, many of these can result in amputation. Worst of all, injection can lead to the transmission of HIV, hepatitis, and other bloodborne pathogens. Since sterile needles can be hard to find, heroin users often share needles. This almost always leads to them contracting deadly illnesses. Now that we know the background, let's first start talking about some of the benefits syringe services programs provide to the community. Syringe service programs often reduce infection and their spread. Non-sterile injections can lead to the transmission of many different types of infections. And in addition to being at risk for HIV, viral hepatitis, and other bloodborne, sexually transmitted diseases, people who inject drugs can get other serious, life-threatening, and costly health problems, such as infections of the heart valves, known as endocarditis, serious skin infections, such as cellulitis, and deep tissue abscesses. When access to sterile syringes and other injection equipment is provided, it helps to prevent transmission of bloodborne and other infections when they inject drugs. Easier access to sterile injection equipment can help prevent these infections, and healthcare services provided at SSPs can catch these problems early and provide treatment for a population that may be reluctant to go to a hospital or seek other medical care. Research studies have looked at the effects of syringe service programs on infectious disease rates across numerous cities. SSPs were associated with decrease in the prevalence of HIV and hepatitis C, along with decrease in the incidence of HIV. Studies investigating the effect of New York's syringe exchange program between 1960 and 2002 found a reduction in HIV prevalence from 50 to 17%. And a reduction in the prevalence of hepatitis C from 80 to 59% among HIV-negative IV drug users. A study looking at the District of Columbia's Department of Health's exchange program showed a 70% decrease in new HIV cases among IV drug users and a total of 120 HIV cases averted in just 2 years. Along with reducing infection, syringe service programs are also very important in helping reduce drug use in those struggling with substance abuse disorders. Syringe service programs can help people to stop using drugs as well. Injection drug users who use syringe service programs are more likely to enter treatment for substance abuse than those who don't use an SSP. They are nearly 3 times as likely to report a reduction in injection frequency as those that have never used an SSP, and new users of SSPs are 5 times as likely to enter drug treatment as those who don't use the programs. One of the reasons these programs help decrease drug use is by providing a local place for community support groups and other service providers and they can assist those in seeking drug rehabilitation with resources and contact information. Next, let's address some of the cons that are widely perceived about SSPs. There are many perceived cons relating to syringe service programs. While none of them have been supported by research into these programs, these cons still continue to persist in society. One is that they cause more needles in public places. Studies show that SSPs actually don't cause more needles in public places. They usually protect the public and first responders by providing a place that has safe needle disposal and is reducing the presence of needles in the community. Another is that syringe service programs lead to more crime, increase the rates of drug use, and enable individuals to continue to use IV drugs. Syringe service programs do not cause or increase illegal drug use, nor do they cause or increase crime. In fact, syringe service programs have been shown to help people overcome substance use disorders and increase a user's likelihood of entering into a drug treatment program. This is likely because individuals using SSPs are constantly being offered verbal and physical support, and they may eventually decide to seek their help. Syringe service programs also play a key role in preventing overdose deaths by training people who inject drugs on how to prevent, rapidly recognize, and reverse opioid overdoses. Keeping people alive allows them more chances to consider seeking treatment and increasing their likelihood of getting sober. Many SSPs give clients and community members access to overdose rescue kits and teach them how to use them. This is specifically designed to help individuals identify an overdose, give rescue breathing, and administer naloxone, which is a medication used to reverse an overdose. Other reasons why some oppose needle exchange programs include the financial cost to taxpayers and low access provided to rural injection drug users. Finally, let's talk about the cost effectiveness of SSPs. Financial cost and benefit is often a topic of debate regarding SSPs. Healthcare costs are related to IV drug use are substantial in the US. Hospitalizations for substance use related infections cost over $700 million each year. The estimated lifetime cost of treating a single person living with HIV is more than $450,000. SSPs reduce these costs and help link people to treatment to stop using drugs. An analysis of a New York City needle exchange estimated that a baseline 1 year savings to the government of $1,300 to $3,000 per client. Another analysis estimated that expanding access to clean syringes across the country with an additional annual investment of $10 million would result in 194 HIV infections averted in 1 year, a lifetime treatment cost savings of $75.8 million, and a return on investment of $7.58 for every $1 spent. When comparing the cost of treatment of the things SSPs can prevent versus the cost of SSPs, it is clear that they are cost effective. During this speech, I have told you exactly how syringe service programs reduce infections, help prevent drug use, as well as talk about what cons are typically perceived about SSPs and why they are not supported by research, and finally, how cost-effective SSPs are. Policies that support access to clean needles and syringes allow for the legal sale of needles without prescriptions and include programs to distribute clean needles and safely dispose of the used needles. These type of policies are typically enacted at the state level. As of 2016, 16 states had passed laws authorizing needle and syringe exchanges. Several states had also passed laws that removed syringes from lists of illegal drug paraphernalia. SSPs are clearly of huge importance, and they rely on policy that makes them more accessible and more widely available all across the US. We need more policy change to help get these programs available in more cities to more people. Syringe service programs also rely on funding that help keep their doors open so they are able to provide these services. With people not accepting the proof that SSPs are beneficial in reducing IV drug use and their effectiveness at preventing the spread of infection, they are struggling to keep enough funding to keep their doors open, and this could be detrimental.